Hello, and welcome to the video in our Coordinated Entry New User Training. This video will discuss the core components of coordinated entry along with some elements of a successful coordinated entry system. In the last video, we discussed how HUD required that all continuums of care throughout the country begin to use a coordinated entry system. In this requirement, there are 4 core components. If you take away anything from this video, please let it be this list of things. A successful coordinated entry system should have all of the following. Number 1 is access. There should be a centralized and standard way to access all of the resources within a continuum of care, so a client doesn't need to bounce from provider to provider. Number 2 is assess. This means that all households experiencing a housing crisis have their needs assessed in a standardized way. This is to gather information about their needs, their preferences, and the barriers that they will face when regaining housing. Third is prioritize. We know that we don't just have a basket of keys sitting in the lobby for everyone that needs a place to live. Housing, unfortunately, is scarce, and we do not have unlimited funding. So this core element is to make sure that our system is prioritizing the most intensive resources for those with the most intensive needs. This doesn't mean that we don't try to help everyone. The system is designed to be able to solve problems, not just to disperse funds. But unfortunately, a core element of this is to reserve high cost and high intensity resources for those with the highest needs. In prioritization, we are non-judgmental. We examine a client situation objectively and determine what will it take to end their homelessness. The fourth is referral or connect. The goal is to actually connect a client to resources that meet their needs. This includes connecting at-risk households to services to prevent their homelessness, connecting clients that are actively homeless to mainstream resources or networks to rapidly exit them from homeless, and connecting high-risk clients who are also experiencing homelessness to subsidized housing, both permanent and temporary. HUD uses the term referral, but we prefer connect because we're not just building a system that fills program slots and spends our grant funding. We're trying to develop a system that has problem solving as its key aspect in how we do business. We might not have a subsidized housing spot in a permanent supportive housing or a rapid rehousing program, but that doesn't mean that we just give up on helping the client. We discuss the nature of the problem with them and work with the client to find solutions, some that involve our pre-designed programs and some that will not. So those are the 4 key HUD components, but we at the state of Maryland also add a 5th, support. This means that after a client is done with coordinated entry, the system continues to take an interest in them and ensure that the solutions actually worked out well for the clients, and perhaps offer other solutions if they did not. In addition to the 4 core federal components and the 5 core components that we use in the state of Maryland, there are some other elements of an effective coordinated entry system that will be essential to the program's success. This list is an excerpt from a publication by HUD in 2015 called the Coordinated Entry Policy Brief. The first element of a good coordinated entry system is that it uses a similar prioritization process for all project types. An effective coordinated entry process ensures that people with the greatest needs receive priority for any type of housing and homeless assistance available in the COC. That includes permanent supportive housing, rapid rehousing, and other interventions. Take an example. A client has a high vulnerability and qualifies for an intensive assistance program. However, there are no vacancies in the high-intensity program. Rather than telling the client to stay homeless while waiting for the more intensive program, which can take months or even years, coordinated entry can instead offer that client a less intensive intervention in the meantime. It should be the client's choice. Next, a good coordinated entry system is low barrier. The coordinated entry process does not screen people out for assistance because of perceived barriers to housing or services. That includes but is not limited to a lack of employment or income, drug or alcohol use, or having a criminal record. In addition, housing and homelessness programs lower their screening barriers in partnership with the coordinated entry process. Next, a good system has a housing-first orientation. A housing-first orientation means that clients are able to be housed quickly without preconditions or service participation requirements. This means that clients are able to customize their own service package and only take the resources which they need and are not required to participate in services as a precondition of their housing. This is, of course, a general orientation. Some grants may require service participation, but in general, the system has a philosophy that clients are not refused services to go through a prescriptive path. This also means that programs take clients as they present. There is no requirement in coordinated entry that a client be clean or that a client have employment before the system is willing to help them. Going hand in hand with a housing first orientation is a person-centered orientation. This means that the system does everything it can to incorporate participant choice into its processes. When, and to the extent possible, clients should be free to choose their locations and type of housing, the level of services they will receive, and other facets of the housing process. This doesn't mean that clients will get everything they want out of the system at all times, but we should remember that the system exists for the client's benefit, not for ours. So we should do everything in our power to make sure that their voice is being heard, and we are respecting their autonomy and dignity at every step of the way. Next is fair and equal access. All people in the continuum of care's geographic area should have fair and equal access to the coordinated entry process, regardless of where or how they present for services. Fair and equal access means that people can easily access coordinated entry processes, whether in person, by phone, or some other method, and that the process for accessing help is well known to the community. Next is marketing strategies. This doesn't mean you need to be Don Draper from Mad Men. Marketing strategies may include direct outreach to people on the streets and other service sites, informational flyers left at service sites and public locations, announcements that are made during COC or other coalition meetings in the community, and educating mainstream service providers. If the entry point to the system includes one or more physical locations, they need to be accessible to people with disabilities and easily accessible by public transportation if that's available. If public transportation isn't available, there should be some other way that makes it easy for clients to get access to the system. The coordinated entry process should also be able to serve people who speak the languages commonly spoken within the community. Next, a coordinated entry system should be inclusive. That means that all subpopulations, including people experiencing chronic homelessness, veterans, families, youth, and survivors of domestic violence. However, COCs may have different processes for accessing coordinated entry, including different access points and assessment tools for different subpopulations, such as adults without children, adults with children, unaccompanied youth, and households fleeing domestic violence. However, these are the only 4 groups in which different access points may be used. Inclusive access points means that there is not a separate coordinated entry process for people with mental illness or people with addictions, although the system addressing these disabilities may serve as a referral source into the process. The COC should continuously evaluate and improve the process to ensure that all subpopulations within the community are being well served. Next, continuums of care should engage in ongoing planning and stakeholder consultation. The COC engages in ongoing planning with all stakeholders participating in the coordinated entry process. This planning includes evaluating and updating the coordinated entry process at least annually. Feedback from individuals and families experiencing homelessness or recently connected to housing through the process should be regularly gathered through surveys, focus groups, and other means that is used to improve the system. The information that we gather through the coordinated entry process should be used to guide homeless assistance planning and system change efforts in the community and into the future. Next, a good coordinated entry system leverages local attributes and capacities. This includes keeping mind of the physical geography, including the capacity of partners in the community and the opportunities unique to your particular community's context. These should all inform the local coordinated entry implementation. The last element that we'll be talking about today is full coverage. That means that people throughout the geographic area have the same ability to connect within the system. In large geographically diverse COCs like the Maryland Balance of State, the COC may use several different coordinated entry processes for each local homeless coalition, or LHC. But there should be no neighborhood or area or region within the continuum of care that is not covered by the continuum of care and where clients cannot access the services that they need. So long as you're within the balance of state, there will be an LHC who can help you. It doesn't matter if you're in the middle of town or in the middle of the woods. The system treats you the same. That's all for today. In this video, we had discussed the core elements of coordinated entry and some components of a successful coordinated entry system. Goodbye.